Good afternoon, everyone, and thank you all for attending today's webinar on getting credit for your work, how to measure an educational intervention in a clinical setting. This webinar is sponsored by the American Thoracic Society's section on medical education. So today we will explore how innovative medical education interventions like gamification and high fidelity simulation can rigorously be measured, evaluated, and translated into meaningful academic credit. I am Richa Nahar. I'm an assistant professor at Northwell Health in New York City, and I'm going to be moderating this session. I have an absolutely amazing co-moderator who's going to introduce herself and walk us through the next couple slides on the webinar series.
Hi, everyone. My name is Shilpa Sridhar. I'm a second-year fellow at The Ohio State University in Columbus, Ohio. We are joined by a couple awesome panelists whose names are listed here, and they're going to introduce themselves just after we finish a couple introductory slides. So just as an FYI for everyone that's listening, this webinar is part of a 10 webinar series. The first was in September of last year, and here's a list of the ones that have occurred and where you can find prior webinars. And here are some of the titles of the upcoming webinars as well. Please make sure you're on the ATS mailing list to get notified about these.
Great.
And I'll hand it back over to Richa to start our introductions.
Yeah, thank you. Thank you, Shilpa. So over the last decade or so, we have seen a shift in how the traditional learning methods are now being changed into more active learning interventions, especially in healthcare. Now, gamification is one of the active learning methods, and it is a structured competition that can drive learner engagement, can improve team dynamics and knowledge retention, all through intrinsic motivation and sense of accomplishment.
Um, so another part of what we're going to be talking about today is using high fidelity simulations. So these are simulations that replicate high acuity, low occurrence events. Those are also called halo events. And these simulations can help prepare trainees to handle these without risking a patient or causing harm to a patient as they try something new in a really acute setting.
And so we have two excellent panelists who are going to guide us through the conversation and discussion from their insights from their published work on ICU gamification and simulation-based mastery for learning massive hemoptysis management. And I'm going to have our excellent panelists introduce themselves and tell us a little bit about their published work.
I'll start. Hi, everybody. My name is Mauricio Danckers. I'm the program director for the PCCM fellowship here in South Florida and HCA Florida Ventura Hospital. I'm also an associate professor of medicine from FIU. Very happy and thank you for the invitation. I think people coming in. Thank you for giving me the opportunity to talk about my prior scholarship work on gamification in medical education. Not gonna take too much time, but just to give you a framework, and for me, this particular project is very dear to my heart for two reasons. The first one, the impact it had until today. And second, it helped us move forward after the COVID pandemic. It started as an idea to highlight our GME trainees post-pandemic, going back to work and not be that easy. And we wanted to recognize the contribution to the medical education and to the patient care workflow in our institution. So we decided to do this very massive event, celebratory in nature, highlighting their skills in a competition-like manner, where we introduce 4 days of games in medical education, and we assess their knowledge and retention of knowledge down the road. We have a really good perception, data, positive outcomes, as well as behavioral and models of retention of knowledge that we were able to publish it as a pilot study. And now we are actually publishing our manuscript multi-center. We were able to take this experience portable and take it to other hospitals around the area. So I'm very excited for that manuscript to follow up.
I can happen. My name is Melissa New. I'm an associate professor at the University of Colorado, and I'm one of the associate program directors for the Pulmonary Critical Care Medicine Fellowship here. My scholarship and educational work in the last several years has been focused on procedural education, and particularly bronchoscopy and bronchoscopy education. And when I started teaching bronchoscopy, there were a few areas of need that I identified as areas where that our fellows felt they wanted to have better skills and didn't quite feel like they were being trained adequately. And one of those was airways emergencies, and particularly hemoptysis and management of lower airway bleeding. So I started teaching it, and I just felt that the way I was doing it was not adequate to meet the needs of our fellows and our learners. And so I worked with some folks on our campus and had the benefit of an institutional grant to support the work in terms of developing a hemoptysis simulator. There wasn't one we could buy off the shelf, and nor do we have the budget for that, but we were able to work with our sim lab and some folks on campus to 3D print an airway tree. And then through the process of a couple of years of getting the simulator working and then practicing it with our fellows, able to study it in a more rigorous way and share our results of demonstrating benefit of that intervention to our fellow learners through a publication. And one of the most rewarding parts about that project has been like hearing from our fellows that after they have practiced in a simulated environment, that it has really changed the way they have approached and felt comfortable approaching cases of massive hemoptysis. And then our fellows who have gone out into practice, some of them have reached back out to me and just told me how good they feel in terms of like when they are the expert, they are called for a case and they feel ready and competent to manage these really scary cases. And so that's been really exciting. And then through the publication of our work, I've been contacted by folks who are interested in replicating our intervention and have successfully done so at institutions actually around the world, which is really very, very fun. So I'm very passionate now, especially about doing this kind of work about in simulation and then also dissemination, because we live in a bigger educational community.
Amazing. Thank you both for those awesome introductions and summaries of your projects. With that, we'll probably just jump right into some of the questions that Richa and I had, and we also took input from questions that the participants in this webinar put in during their registration. So I'll stop sharing my screen and we can jump right into those. The first question is when you start to think about success as far as a scholarly activity in medical education, what are some of the outcomes that matter most to both of you, Dr. Danckers and Dr. New?
Yeah, and I think, part of my role, I'm in a community setting, so I think it will be great to have Melissa and I bounce back ideas in the academic setting and community setting. But I think in the community setting, one thing that is important for me is to assess something and look for something that is practical and feasible. Resources may be different and how to obtain them may follow different pathways. But I think it's important to realize that what we want to measure is something feasible. We always look at these categories of we're going to do behavior, knowledge, patient outcomes, and that's important. But I think the first word that rings the bell is it is feasible for me to do. And it is practical to gain the support of the stakeholders. And I want to keep saying this through the entire webinar because we don't work in silos. And that was a common mistake. And I know there's a question probably of pitfalls, but I will say from the beginning, we need to plan for all the stakeholders buy-in. So then success could be defined very different depending on which stakeholder you're asking. But if you as a medical educator think about that ahead, then the pitch, because at the end we're pitching an idea, will vary depending on who are you aiming for. Of course, as medical educators, we want ultimately our patients to be the ones benefit from the intervention. But it will be the conduct of our learners, the one who achieve it. In that process, several things need to be implemented and followed through. And feasibility comes as a constant reminder that I need the support of the stakeholders. But I think that the outcome that matters most to me is the outcome that matters most to all of us, in a way to be able to make research feasible and actually reach the point of publication, dissemination, and impact our communities.